Doctor, when you talk about some of the obesity conditions that we see, are there certain people or certain conditions that tend to do better on the HCG diet or are better candidates to go on that?
Well, it's a very interesting question, and I cover all of this in my book, but understand we have open label observation, not controlled studies to work with. But it seems very clear that men lose weight more rapidly than women on this diet, you know, in a very accelerated manner. Some reports of up to a pound a day, you know, they can drop easily 7
Wow.
pounds. In a 6-week period in a man, you know, it's not unusual to experience very significant weight loss, like up to 40 pounds in 6 weeks. And that's documented, that's not hearsay. So that's one issue. There are contraindications to this diet. For example, in the book I talk about, you know, you're not going to use this diet in somebody with uncontrolled diabetes. You're not going to use this diet in somebody who's stressed with a coexisting chronic disease. You should never consider this diet in pregnancy, and I don't think we have enough information to consider it in childhood. But what is childhood as defined below the age of 18 years? And there are issues of informed consent, because obviously it's a non-approved use of a drug. And that's what's made it controversial. And recently, USA Today ran an article on the FDA's approach to the fact people have been using what they called homeopathic HCG drops rather than injections. The Simeon's diet involves 150 units approximately of HCG injected, but people have been using what they call homeopathic drops. And of course, the FDA has considered that to be potentially fraudulent, because in the American pharmacopoeia, there is no listing of HCG as a homeopathic agent for weight control. So they're working a bit by the rules and regulations here, because again, there are anecdotal reports out there showing favorable responses to homeopathic drops, which are obviously a more dubious use of HCG rather than the classic Simeon's method of injection of HCG with the very low-calorie diet. So in essence, that sums it up. And in the Anti-Aging Triad book and in the HCG Diet Revolution, you will see extensive discussions of managing metabolic syndrome X, which for general consumption is what I call everyday after dinner conversation. The variable combination of being overweight, having high blood pressure, having abnormal blood cholesterol, all linked together by insulin resistance in a pre-diabetic state. Now we have an estimated 70 million Americans with syndrome X. We have 20-odd million diagnosed diabetics. Probably it's more like 40 million, because as many as half of them are walking around undiagnosed. And we're getting into an issue where I think if we look at Michelle Obama's approach now to childhood obesity, it's a real issue. Because what we're creating is a society of pot-bellied dinosaurs that have many, many disease associations. So metabolic syndrome is a disease of premature aging. And the combat against syndrome X is a hugely important public health initiative. In my writings, I say it's the #1 public health initiative. But you've got to connect the dots. You've got to deal with all of these risk factors together, and there's no drug can do that. It's a lifestyle, nutritional approach with, you know, many, many factors. And we don't fully understand the cause of it. There's certain genetic issues going on. And, you know, in my book, I point out the following, that if we've got about 62% of African American females between the age of 50 and 65 with metabolic syndrome, the same number 62% Hispanic population, and we look at Caucasian women, 50%. I coined an aphorism, and that is that metabolic syndrome X is loading the gun of disability for the mature female, and the milestone of menopause is pulling the trigger. And some of the bullets in the gun could have been the inappropriate use of conventional hormone replacement therapy. So it's a kind of bold statement, but again, I'm synthesizing this information, and there's no question that the real significance of the menopause is the age-related onslaught of disease, like cardiovascular disease, osteoporosis, breast cancer. And so bringing these theories together, we're seeing unifying concepts to disease, and we're starting to understand how we may, as a race, have outlived our ability to keep up with our so-called advanced lifestyle, which in simplistic terms is characterized by idleness and excess calorie intake, which takes us back to calorie restriction. So you see this is a whole sort of series of circular and Eulerian diagrams of logic.